After 80, your body doesn't just age, it changes the rules completely, and most people never see it coming. If you or someone you love is approaching this stage, what you're about to hear could protect your independence and your life. There is a moment that nobody warns you about, a quiet shift that happens somewhere around the age of 80, and it does not matter how strong you were in your 60s, it does not matter how active you were in your 70s, it does not matter how many marathons you ran, or how many push-ups you could do back in the day. When you cross that threshold into your 80s, your body starts playing by a completely different set of rules, and if you are not aware of what those rules are, they will catch you off guard in ways that can genuinely change the course of your remaining years. Now here is the thing that frustrates me the most as a doctor. Most people do not learn about these changes until they are already dealing with the consequences. They show up in my office confused, frustrated, sometimes even scared, and they say, "Doc, I was fine just a year ago. What happened to me?" And I have to sit down and explain that their body did exactly what it was always going to do. They just were not prepared for it. So today I am going to make sure that does not happen to you or to someone you love. Whether you are already in your 80s, approaching your 80s, or you have a parent or grandparent who is in that age range, what I am about to share with you could be some of the most important health information you ever hear. My name is Dr. Ethan Parker, and on this channel we talk about real health information that actually matters, especially for those of you in your senior years. So if you have not already, go ahead and hit that subscribe button and tap that notification bell, because I release content like this regularly, and I do not want you to miss a single video. Now let us get into this, because what I am about to tell you, nobody else is going to say it this directly. The first thing that happens once you turn 80, and this one catches almost everybody off guard, is that your body starts losing muscle at an accelerated rate that is unlike anything you have experienced before. Now I know what some of you are thinking. You are saying, "Dr. Martin, I have been hearing about muscle loss since I was 50. This is not new information." And you are right. Muscle loss does begin in your 30s, and it gradually continues throughout your life. But here is what most people do not understand. The rate of muscle loss between the ages of 30 and 70 is relatively slow and manageable. You might lose about 3 to 5% of your muscle mass per decade during those years. But once you hit 80, that number jumps dramatically. We are talking about losing up to 15% of your remaining muscle mass in a single decade, and in some cases even faster than that. This condition has a medical name. It is called sarcopenia, and after 80 it becomes one of the most dangerous threats to your independence, your mobility, and honestly your life. Let me tell you why this matters so much. Muscle is not just about looking strong or being able to lift heavy things. Your muscles are what keep you upright. They are what prevent you from falling when you stumble on a crack in the sidewalk. They are what allow you to get up from a chair without assistance, to climb a flight of stairs, to carry your own groceries, to maintain the basic functions of daily living that most people take completely for granted. When your muscle mass drops below a certain threshold, and this is the part that terrifies me as a physician, your risk of falling increases exponentially, and a fall at 80 is not the same as a fall at 40. At 80, a fall can mean a broken hip, and a broken hip at that age has a mortality rate that would shock most people. Studies show that roughly 20 to 30% of elderly adults who suffer a hip fracture die within 1 year. Not from the fracture itself, but from the complications that follow. The immobility, the infections, the blood clots, the rapid decline in overall health that comes from being bedridden. So what can you do about this? And this is where I want to give you real practical advice, not just scare you. Resistance training does not stop being effective just because you are 80 years old. In fact, research has consistently shown that even people in their 80s and 90s can build muscle and increase their strength through appropriate resistance exercises. I am not talking about heavy deadlifts or bench pressing twice your body weight. I am talking about simple, safe, supervised strength training, chair squats, resistance band exercises, light dumbbell work, even body weight movements can make a tremendous difference. The key is consistency. You need to be doing some form of resistance exercise at least 2 to 3 times per week, and you need to be consuming adequate protein. Most seniors in their 80s are not eating enough protein, and that is fueling the muscle loss even further. Aim for at least 1 gram of protein per kilogram of your body weight every single day, and spread it across your meals rather than trying to get it all in one sitting. Your muscles need that steady supply of amino acids to maintain themselves and to repair after exercise. Now, the second thing that happens after 80, and this one is deeply personal for a lot of people, is that your brain begins to process information differently. I want to be very careful with how I explain this because there is a huge difference between normal age-related cognitive changes and dementia, and too many people confuse the two, which causes unnecessary panic. After 80, it is completely normal to experience what we call slower processing speed. This means it might take you a little longer to recall a name, a little longer to find the right word in conversation, a little longer to make a decision or solve a problem. This does not mean you have Alzheimer's disease. This does not mean you are losing your mind. This is your brain operating with slightly less efficiency, which is a natural part of aging. However, and this is the important part, after 80, the risk of developing actual dementia does increase significantly. By the age of 85, roughly 1 in 3 people will have some form of dementia. That is a staggering number, and it is one that we cannot afford to ignore. The brain, much like your muscles, needs to be exercised and maintained, and the research on this is incredibly encouraging. Studies have shown that people who remain mentally active, socially engaged, and physically active have significantly lower rates of cognitive decline compared to those who become sedentary and isolated. One of the biggest mistakes I see in my patients over 80 is that they start withdrawing from social activities. They stop going to church. They stop meeting friends for lunch. They stop participating in community events, and they spend more and more time alone in front of the television. Social isolation is one of the most powerful accelerators of cognitive decline that we know of. Your brain needs stimulation. It needs conversation. It needs novelty. It needs challenge. So if you are over 80 or you know someone who is, please encourage social connection. Join a book club. Volunteer at a local organization. Take a class at a community center. Play cards with friends. Do crossword puzzles. Learn a new skill. It does not matter what it is, as long as it keeps your brain engaged and keeps you connected to other human beings. And let me add one more thing about brain health after 80 that most doctors will not tell you. Sleep becomes absolutely critical. I know that sleep patterns change as you age, and many seniors struggle with insomnia or fragmented sleep, but your brain uses sleep to clear out toxic proteins, including beta-amyloid, which is directly associated with Alzheimer's disease. If you are not sleeping well, those proteins accumulate faster, and your risk of cognitive decline increases. Talk to your doctor about your sleep. Do not just accept poor sleep as a normal part of aging. There are strategies and interventions that can help, and they could make a real difference in protecting your brain. The third thing that happens after 80, and this is one that a lot of people do not want to talk about, but we need to, is that your bones become significantly more fragile. Now, similar to muscle loss, bone density loss begins much earlier in life, particularly for women after menopause. But after 80, we reach a point where the bones have lost so much density that even minor impacts can cause fractures. This is osteoporosis at its most advanced stage, and it affects both men and women, although women are disproportionately impacted. Here is what makes this so dangerous. Your bones are not just getting thinner, they are also changing in structure. The internal architecture of your bones, the trabecular bone, which is the spongy inner network that gives bones their strength, becomes increasingly porous and weak. This means that a simple stumble, bumping into a piece of furniture, even a forceful sneeze in severe cases, can cause a compression fracture in your spine or a fracture in your wrist or hip. And once you have one fracture, your risk of having another fracture doubles or even triples. What can you do about this? First and foremost, get a bone density scan if you have not had one recently. Know where you stand. Second, make sure you are getting adequate calcium and vitamin D. Most adults over 80 need at least 1,200 milligrams of calcium per day, and at least 800 to 1,000 international units of vitamin D. Some people may need even more, especially if their blood levels of vitamin D are low. And trust me, most seniors have insufficient vitamin D levels. Your doctor can check this with a simple blood test. But beyond supplements, the single best thing you can do for your bones after 80 is weight-bearing exercise. Walking, standing exercises, gentle dancing, even just standing up and sitting down repeatedly, these activities put stress on your bones in a good way. Your bones respond to mechanical stress by reinforcing themselves by laying down new bone tissue. If you stop moving, if you become sedentary, your bones get the signal that they are not needed anymore, and they weaken even faster. So please keep moving. Every step you take is literally telling your bones to stay strong. The fourth thing that happens after 80 is something that I see devastating so many of my patients, and it is the decline in balance and coordination. This is related to muscle loss and bone loss, but it is also its own separate issue. After 80, the systems in your body that control balance start to deteriorate in ways that can be really frightening. Your inner ear, which houses your vestibular system, that is the system responsible for your sense of spatial orientation and balance, becomes less sensitive and less accurate. Your proprioception, which is your body's ability to sense where it is in space, also declines. And your vision, which plays a huge role in balance, often deteriorates further in your 80s due to cataracts, macular degeneration, or other age-related eye conditions. When you combine weaker muscles, more fragile bones, a less reliable vestibular system, declining proprioception, and worsening vision, you get a perfect storm for falls. And as I mentioned earlier, falls at this age can be catastrophic. The statistics on falls in adults over 80 are alarming. Roughly 1 in 3 adults over 65 falls each year. But after 80, that number climbs even higher, and the consequences become far more severe. So what do we do about this? Balance training. And I cannot emphasize this enough. Balance training should be a non-negotiable part of your daily routine if you are over 80. Simple exercises like standing on one foot while holding onto a chair, heel-to-toe walking along a straight line, Tai Chi yoga adapted for seniors. These activities train your brain and your body to maintain stability. And here is what is really encouraging. Balance can be improved at any age, even if you feel unsteady right now, even if you have already had a fall. You can regain significant balance ability through consistent training. I also want to mention something that often gets overlooked, and that is medication review. Many seniors over 80 are taking multiple medications, and some of those medications can cause dizziness, lightedness, or drowsiness, all of which increase fall risk. Blood pressure medications, sleep aids, certain antidepressants, antihistamines, even some pain medications can affect your balance. If you are over 80 and you feel unsteady, ask your doctor to review every medication you are taking and assess whether any of them could be contributing to your balance problems. Sometimes a simple adjustment in medication can make a dramatic difference. And please do not let pride get in the way of safety. If you need a cane, use a cane. If you need a walker, use a walker. If you need grab bars installed in your bathroom, get them installed today. Not next week, not next month, today. These are not signs of weakness. These are tools that keep you safe, keep you independent, and keep you alive. I have seen too many patients who refuse to use assistive devices because they felt it made them look old or frail, and then they suffered a devastating fall that took away their independence permanently. Do not let that be your story. Now, the fifth thing that happens after 80, and this might be the most important one of all, is that your immune system becomes significantly weaker. This is a process called immunosenescence, and it is one of the primary reasons why adults over 80 are so much more vulnerable to infections, illnesses, and even cancers. Your immune system has been fighting for you your entire life. It has been battling bacteria, viruses, fungi, and abnormal cells for decades. But after 80, it starts to wear down. Your body produces fewer new immune cells, the ones you have become less effective, and your inflammatory responses become dysregulated, meaning your body can overreact to some threats while underreacting to others. This is why a simple cold or flu that a younger person might shake off in a few days can land an 80-year-old in the hospital. This is why pneumonia is one of the leading causes of death in adults over 80. This is why urinary tract infections, which are relatively minor in younger adults, can cause confusion, delirium, and serious complications in elderly patients. Your immune system simply does not have the same firepower it once had. What can you do to support your immune system after 80? Several things. First, nutrition becomes even more critical. Your body needs adequate vitamins and minerals to maintain immune function. Vitamin C, vitamin D, zinc, and selenium are all important for immune health. Eating a varied diet rich in fruits, vegetables, lean proteins, and whole grains provides the building blocks your immune system needs. Unfortunately, many seniors over 80 have poor appetites or difficulty preparing meals, which leads to nutritional deficiencies that further weaken their immunity. Second, stay up to date on your vaccinations. I know there are a lot of opinions about vaccines out there, and I am not here to get into a political debate. I am here to tell you the medical reality. Vaccines like the annual flu shot, the pneumonia vaccine, and the shingles vaccine can be genuinely life-saving for adults over 80. Your immune system may not respond as robustly to vaccines as a younger person's would, but even a partial immune response is far better than no protection at all. Talk to your doctor about which vaccines are recommended for your age group and your specific health situation. Third, and this circles back to everything else I have been saying, stay physically active. Exercise has been shown to boost immune function even in elderly adults. Moderate physical activity increases the circulation of immune cells throughout your body, reduces chronic inflammation, and improves your overall resilience against infections. You do not need to run a marathon. A daily walk, some gentle stretching, light resistance exercises, these are enough to give your immune system meaningful support. And I want to bring up one more thing about the immune system after 80 that is really important. Chronic stress and loneliness directly suppress immune function. There is a growing body of research showing that socially isolated elderly adults have significantly weaker immune responses compared to those who maintain strong social connections. Loneliness is not just an emotional problem, it is a biological one. It raises cortisol levels, increases inflammation, and suppresses the activity of your natural killer cells, which are the immune cells responsible for detecting and destroying cancerous cells and virus-infected cells. So once again, staying connected, staying engaged, staying part of a community is not just good for your mental health, it is essential for your physical survival. Now I want to take a moment to say something that I think needs to be said more often. Turning 80 is not a death sentence. It is not the beginning of the end. I have patients in their 80s and even their 90s who are vibrant, active, sharp, and deeply engaged with life. They are not superhuman. They are not genetically lucky. They are simply people who took their health seriously, who stayed active, who maintained their social connections, who ate well, who worked with their doctors, and who refused to accept decline as inevitable. Yes, the 5 things I have talked about today are real. They will happen to some degree whether you like it or not. Your muscles will weaken, your brain will slow down, your bones will become more fragile, your balance will decline, and your immune system will become less effective. These are biological realities, but the degree to which they affect you, the speed at which they progress, and the impact they have on your quality of life, that is largely within your control. Every single day, you have a choice. You can choose to sit on the couch and let these changes overtake you, or you can choose to fight back with movement, with nutrition, with social connection, with mental stimulation, with medical care, and with a stubborn refusal to give up on yourself. I have seen 80-year-olds who move better than some 60-year-olds I know. I have seen 90-year-olds with sharper minds than people half their age. Age is a number, but how you age is a decision. If you found this video helpful, and I truly hope you did, please do me a favor and share it with someone who needs to hear this. Share it with your parents, your grandparents, your friends, your neighbors. This information can genuinely change someone's life and potentially save it. Hit that like button, subscribe to the channel if you have not already, and leave me a comment below telling me what topic you would like me to cover next. I read every single comment, and your feedback helps me create content that truly serves you. This is Dr. Ethan Parker, reminding you that it is never too late to take control of your health. Your body is more resilient than you think, but it needs your help. Give it the movement, the nutrition, the rest, and the care it deserves, and it will carry you further than you ever imagined possible. Take care of yourselves, and I will see you in the next